What is the anterolateral thigh free flap defect or donor site recovery like? My name is Amit Kochhar. I'm a facial plastic surgeon at Pacific Neuroscience Institute and Pacific Head and Neck Institute. Today I'll be discussing how to manage your anterolateral thigh defect following free tissue transfer or free flap reconstruction for a head and neck defect. The anterolateral thigh is the side of your thigh, and we typically use the ipsilateral side, or the side that's involved on the site of reconstruction. We will take anywhere between 24 by 10 centimeters, so a pretty large chunk of skin and muscle, along with an artery and vein from the lateral aspect of the thigh. That wound is usually closed primarily, or closed without any need for a skin graft, although in rare cases, if the defect is very large, a skin graft is needed. We usually close that defect with sutures that are absorbable and staples on the outside. You'll also have a drain in the leg as well to help remove any additional fluid that accumulates during the healing process. Patients typically have limited range of motion in their lower extremity for a few days or weeks after surgery, but typically within 1 month they're able to walk briskly, they're able to lightly jog, and they're able to exercise. In rare cases, the drain will stay longer than the hospitalization and have to be removed in the office. Typically, however, all staples and any other sutures will be removed before you leave. There is a scar that forms on the side of the leg where the incision was placed, and that usually heals within 6 to 12 months. If there are any wound healing issues, we'll usually address them during your fall appointments, typically at the 1 month, 3 month, or 6 month visit. Again, patients typically do not complain of limited range of motion after the initial healing process. There's very low risk of infection. However, patients can develop what's called a seroma, and that's why we keep the drain in longer. That's fluid that accumulates in the thigh as the wounds are healing, and if that happens, sometimes you might require drainage, which can be done in the office under local anesthesia. The ALT free flap can be used for many different defects of the head and neck. Typically, we'll use it for covering scalp wounds. We can use it for reconstructing the tongue. We can also use it for reconstructing the undersurface of the cheek if you have a radical parotidectomy defect. So it's a very versatile reconstructive option for us, and one we use very often. If you have any questions about this, please reach out to our medical assistants or to myself directly via email, and we'll get back to you as soon as possible.